So I'm going to be doing a ligament test. I'm going to be testing the posterior cruciate ligament, and I'm going to be doing the posterior drawer test. So first with this test, I have to do a slight mini test just to assess both sides of the knee. So if I can have you flex both your knees and put them on the table. And I'm going to line up her ankles. This is known as the sag sign test. So I'm just going to have her ankles lined up, and I'm just going to be seeing if her patellas and her tibial tuberosities and her condyles or her tibia are lining up, which they are, because it could create a false negative for the posterior drawer because it could already be ripped, but I'd be pushing on it and it would feel that it wouldn't push any further because it was ripped. So now that we've ruled that out, I'm going to put your leg down. So I'm going to be testing your right leg. So I'm going to stabilize the femur, and I'm going to put my hand on the tibia, around the top of the tibia, and I'm going to exert a force onto the tibia, posterior force. And you have no pain, you're okay. And I'm just going to do this and see if I feel any movement. She has a slight movement, which you're supposed to have. But if the test was positive, she would have a lot more movement than normal, so that would make it positive. But because she doesn't, it's a negative test for torn or fully torn or partially torn PCL, which is your posterior cruciate ligament.